Welcome to Healthcare APPtitude, where healthcare's thought leaders will examine ways to address the rising costs of care in America. We'll also examine how the latest advances in mobile apps are helping hospitals and health systems bend the cost curve and improve patient engagement.
Welcome to Healthcare APPtitude. I'm Tom Testa along with Bruce Kennedy. And Bruce, we've got a great show in store for our listeners as we're going to be joined by a NICU doctor from South Shore Hospital. They're out in Weymouth, Massachusetts, and part of the South Shore Health System. And we're going to hear from this doctor about how her NICU team integrated mobile app technology into their care plan in order to make the parents of these newborns as part of their care team. And I think that's such a great part of what they're doing out there in South Shore Hospital.
Yeah, Tom, I'm really looking forward to talking with Dr. Kubicka. You know, we've had a relationship with South Shore, a wonderful relationship for quite a few years now, and have been able to help them with a number of patient-facing applications. With their FICare app, they've done something really innovative in both balancing the needs of the patient family, obviously, because you're dealing with NICU patients, but also being able to look at how you balance the adoption and utilization of these type of applications in your clinical environment. So I'm really excited to talk to Dr. Kubicka today.
Yeah, no, I think it's going to be a great conversation and one I think our listeners are going to enjoy. So without further ado, here with us to talk about the app is Dr. Zuzanna Kubicka, an attending neonatologist and clinical assistant director working in the Messina Family Neonatal Intensive Care Unit at South Shore Hospital. She also serves as Boston Children's Hospital Network Director for Newborns. Thank you for joining us, Dr. Kubicka.
Great to be with you here today, and I'm really excited to talk about it as this is really, really close to my heart.
Great, excellent. So doctor, talk to us a bit about your role as well as about the NICU and those working in the unit, just to give our listeners an idea of, kind of the landscape of the NICU.
So I am a clinical assistant director at South Shore Hospital in our NICU, and also help in my role as overseeing newborns within the Boston Children's Hospital network. And our NICU, I would say, is very unique compared to many other NICUs. We are kind of a small size, located outside the academic center, although we are part of the Boston Children's Hospital newborn medicine. So we have a very close, small team, the team which takes care of those babies. And we became a NICU about 15 years ago. I actually joined the hospital about 14 years ago in 2007. So we have a team of 7 neonatologists, 5 nurse practitioners, probably about 17 nurses, and also others who really help those babies to grow and progress. So we have speech pathologists, we have nutritionists, we have lactation, we have occupational therapists, we have pharmacists. All these people help us to bring those babies to the finish line, which is a discharge date.
So thanks for that, Dr. Kubicka. As we look at the FICare app, you guys call it FICare, which I think is really cool, stands for Family Integrated Care App. Talk a little bit about how we got here, right? I mean, clearly you were looking to solve some challenges, both internal to the patient journey, right? And then external to supporting families as well. So can you share a bit about what got you interested in developing this type of application on our platform?
Absolutely. So the family role in the NICU was always very close to my heart. So I was watching those families being with us sometimes for 90 days, 120 days. It's a very, very long journey for the family. And I was watching, as we all are watching, those parents, and we call it sometimes a roller coaster ride for the parents. So you can only imagine having a baby in the NICU for that long, being separated from your baby and having to rely on others to care for your baby. And I knew this is extremely stressful journey for the parents. And there is a lot of scientific evidence that this journey for the parents is really stress-inducing. It's a very hard time for parents. And as I was thinking about how we can do better, although our NICU was always extremely family-oriented and we were getting a lot of positive feedback from the families, but I knew we can do better. And I think the significant part of what parents are going through is the sense of lost control. You have no control over the events. You have to rely on others to care for your baby. So when I was thinking about it, there was an amazing study which was just completed, and the study, it was a randomized trial, extremely good quality study, and it was about family integrated care. So in 2018, this amazing paper came out from the Canadian group and Australian group, and was talking exactly about what I was planning to do and what I was thinking to do about the role of family integrated care, how to integrate families more into the daily care, how this improves outcomes, decreases parental anxiety, stress, improves babies' outcomes. So babies were gaining weight better with the usage of breast milk was increased. So many positive effects.
So this sounds great. This is probably the textbook approach to how to build a highly utilized mobile application, right? I mean, you've nailed it without probably knowing what you actually were doing in terms of app technology development. This is awesome. So you identified the challenges, right? Which was one phase of it. You then went and cultivated the research, right? And the science to back up an approach. Talk a little bit about the implementation process, right? The process by which you were then able to get your internal teams on board and then move this thing from concept to reality. For a moment, take out the technology, right? Remove the technology from it and talk about how you were able to get your team involved and on board and really get this thing up and running.
Perfect. So this was an extremely interesting journey, as it always is in life. Yeah. So I was talking to a friend of mine who actually was our former neonatologist and is now a very successful neonatologist in Denver Children's Hospital. And she contacted me with someone who is already implementing this model of care in the NICU in Colorado, St. Joe's NICU. I actually decided that first I want to talk to people who are already implementing this model of care. And I was lucky enough to talk to people in Colorado. And as a part of my journey, I also reached out to Canadian group. And the other funny thing, I was traveling to Australia, and I actually visited the NICU in Sydney, Australia, the Royal Hospital for Children there, and they invited me, and I went there to see how they are implementing it. The one thing I didn't like in all those models, Colorado and Australian one, was that they were using information for the parents and educational materials I was looking for to build were in the format of paper or the links on the computer. And I really was thinking about something way more modern and thinking about the fact that our parents are always sitting at the bedside using their phones or other devices. I decided that the way to go would be the build of the app. Although at this point I was thinking, well, this is way over my head. How I'm going to do this? And I knew that practically nobody has really done it in the United States. I mean, we had some apps built, but it wasn't NICU specific. It was never done by the team in the NICU for the parents in the particular NICU. So that's how it started. But then I actually started some conversations at South Shore Hospital. And I was amazed and surprised at the same time that there was actual platform already, which is the Smith Mobile kind of available for us at South Shore Hospital. So I started those conversations at this point.
So talk a little bit about how you introduce this mobile app to patients, because one of the challenges that invariably all of our listeners who are working in hospitals with technology face, especially patient technology, is you can get good adoption internally for a mobile application that's patient facing. You get everybody on board and then you go to introduce this application, this mobile solution to your patient base. And that's where things sometimes tend to fall down, right? So how do you introduce a mobile application like this to parents who are undoubtedly going through probably some of the most anxious times of their lives as a family and dealing with any number of challenges at that particular time? Talk a little bit about how you get parents on board.
You know, before even talking about that, I think it's important to also kind of realize how to even introduce it to our NICU staff and the NICU nurses and the team, which will be taking care of those babies and parents. because that was the first huge change kind of model of care. Mm-hmm. And the way we did it, we worked really hard for about a year, since 2018 to 19, with the whole NICU team and all those people I mentioned, all the people who take care of our babies, all the subspecialties, and every kind of discipline built their own part of the app. But I knew it's going to be a little bit challenging because it's a huge change in model of care. So the first thing we did, we also reached out to former parents, and the former parents were a really driving force to kind of give us feedback and to tell us what will work, what will not work, what makes sense, what doesn't. And also the interesting part was when we were rolling out the app and the model, we had a very intense training sessions for our staff, for the nurses and everybody taking care of the babies. And I invited former parents to those kind of training sessions. And I think that the voices heard by our team from the parent perspective, we had a really huge impact. Those stories, what parents were missing on, what they needed, and they were actually saying that if they would ever have an app like that, they would just love it, and they would read it left and right. So this was the first step. And then the introduction to the parents. So we decided that whenever the parent goes home, so this is the time when it's a very stressful time. Think about the mom who just had a baby, and instead of taking baby home, they have to leave the baby behind. And that was actually the suggestion from the former parent, that this is the time to introduce this model of care and the app to the parents. So they have something to kind of think about and concentrate on. And the thought is that there is actually something we can do for our baby, even though we are leaving the baby in the hospital and we have to go home and it's very sad, but there will be something we can be actually doing to be involved in baby's care. And we are going to be part of the team, and they are going to help us, and we will learn a lot from them. So this is the first time when we introduce this to parents. So there are many high-risk mothers who stay in the hospital till the time of delivery because they have high-risk pregnancies. So our team, whenever we talk to those mothers who potentially can have a preterm baby, we give them the card with the app link, and we had some mothers who read the entire app just even before the baby was born. On the day of being admitted to the NICU, they said, "Oh my God, we read the whole thing left and right. So we know all about, how you work and what's going to happen." So the one way of introducing it is during those prenatal consults, when we know that this mother will have preterm baby, and she's just waiting, a mother, father, or a partner. And then the other way is when they didn't have that chance, we didn't meet them prenatally. When they go home, we tell them about the app. And that's how the journey starts.
That's awesome. I did want to follow up on one thing you mentioned earlier, because I found it really curious. So you talked about there was a kind of a year-long process of internal planning around this. So I'm really interested now, did the app, or at least the contemplation of the app, change your NICU care design model? Or did you have an existing care design model and the conversation was really more about how do we build this app to conform to our current care design model? So was it a new technology into an existing model, or did the new technology change the way you looked at your care design model from top to bottom?
I think it was more the new technology to existing model. We had many of those things already, but I didn't like the fact that we are giving out some flyers to the parents. Every discipline will have something printed out, pieces of paper. So it was time to kind of consolidate everything and put everything in one place. And I think that's exactly what we did. But some things I would say were added. For example, the parents' participation in rounds. This was the opportunity, and parts of the app talk about it, to bring the parents to that team discussion. So parents, we have multidisciplinary rounds every morning when we talk about every single baby, and we talk about what happened over the last 24 hours, and then we make a plan for the next day. And usually parents were not part of that conversation. We updated them at the bedside later, And we very consistently now have parents invited to rounds either via phone or FaceTime or in person. And this app kind of talks about it as well and introduces parents to that model. So I think it moved us more into the direction of having parents at rounds every day, which everybody loves. Actually, the providers love it too, because we know that we have all the team members there, we have a parent there, and the information is very consistent. And I think that part of the problems or small issues we had in the past was lack of consistency and getting information from different providers, and the information was slightly different. So this is the time when we give this very consistent message to the parents.
Doctor, I was just going to say, you've mentioned a couple of times about having the parents' feedback. And I think anytime you get input from the end user, in which in this case is the parent, right, the caregiver in this case for the child, it's going to make, set you off right on the right foot here in terms of what's needed to launch this thing. In terms of some anecdotes, were you surprised at some of the feedback? Were you thinking, did they make you think of things that said, wow, I didn't really think of that aspect. I know we're here to educate and inform, but there's some things that, wow, that was enlightening. And I think we're going to move forward with something like that.
Yes, I think that sometimes it was surprising. Some feedback from the parents was surprising to the nurses as well. I can give you some examples. So the group of parents I had working on my app, I call them rock stars or superstars, because those parents really went through a lot. And we had some fathers. I really wanted to have some dads in that group as well. And, they were rock stars, but we realized very quickly that the support given by the NICU staff is not everything. So basically, they needed a little bit more of the emotional support. And part of this process was creating a support group for the parents from the former parents. And some of those parents would tell me that there were some days when they were sitting alone and crying because they couldn't see basically the light at the end of the tunnel. Wow. And, some nurses got upset. I didn't get upset about this because I felt we are providers. We are not coming from the perspective of a former parent who went through this 120 days or whatever it is. It doesn't have to be that long of the journey, but it's stressful either way. So we realized that we need some format for supporting psychological support of parents. And the app also talks about our meetings and how we support current parents by former parents. And now we came up with the idea of the former parent joining via Zoom. So we have somebody in person from the hospital side running those support groups, but the former parents. It's extremely positive for many parents, basically when they hear and they sometimes see the baby in the background running around. So, and we had, for example, a family with the twins and who was still in the hospital getting close to discharge, and they have seen a former parent with the twins running in the background. And this was extremely kind of uplifting and positive. And they said, oh my God, I think now we are able to do it. We'll be able to do it, because they couldn't see how this is going to work when they leave the hospital and they are on their own.
You're listening to Healthcare Aptitude on Healthcare Now Radio. In today's episode, we're joined by Dr. Zuzanna Kubicka, attending neonatologist and clinical assistant director at South Shore Hospital. She's also Boston Children's Hospital network director for newborns.
Doctor, one of the things that is an ongoing issue for most intensive care delivery environments is stress, right? Stress of caregivers. And what we have always looked at are ways to build applications and mobile device platforms and ecosystems whereby we're addressing both those areas, right? By using this app, we are able to save money on a lot of the paper or some way be more efficient with how we're distributing information, right? And that's helpful. So that is, in a way, acting as, let's say, an additional staff member that is doing work for you. And some people actually define their mobile application as, my mobile app is an additional staff member handling things that allow us to be more efficient and more patient care directed. And that's always good. And that's more quantitative, right? So qualitatively, you also mentioned that this makes your team feel less concerned, perhaps less anxious about patients having access to information. Does it take any other weight off their shoulders in terms of working in this high stress environment to know that there is a tool like this that is supporting them and patients?
I think you just nailed this, that we have this tool and we have all the information in one place now. Oftentimes the way it works, we are, and mostly the nurses really, but because they spend the longest time with the parent at the bedside. For example, they are talking about some issue, or our lactation is talking about how to pump the milk, how to store the milk. And they talk about it and they say, oh, by the way, if you open up the app, this is the place you can find all this information. So we kind of use it as a go-to place when we go over the small teaching points we have. Again, everything is in one place and we are giving the same message, and even if the nurses are not specializing in milk storage and pumping, they can always send the parent to that place and then the lactation comes and talk to the parent. So I was really hoping to bring the 21st century to our unit because we know how things work now. Everything is online. People use their personal devices all the time. They spend a lot of time using this. So this is a better use of time than just flipping through Facebook pages. But it's challenging, and I was extremely lucky that I found the platform in the hospital which was already available for me. And somebody said to me, "This is not a problem at all." I was completely shocked, as you can imagine.
This is probably not the most difficult application that's built in our environment, but probably one of the more meaningful applications built in our environment. This wouldn't be an interview about a healthcare topic if we didn't introduce the COVID question, right? COVID obviously impacts almost all hospital operations. Can you talk a little bit about the impact of COVID on your NICU operations, and if the application allowed you to better deal with the complications of operating a NICU in a COVID pandemic?
We are still allowing 2 parental visits, 8 a.m. to 8 p.m. Some families, though, liked coming in the evenings. As you can imagine, what happens usually, mom is at home or works part-time if the baby stays for a few months, and many dads or partners go back to work. And they like to visit in the evening. So, for example, the mom would come for a few hours during the day, and that our partner would come in the evening and stay with the baby coming at 7 or 8. So we really did have those parents who really liked nighttime visits. And this was also the time when we continued to educate and teach the parents. So now the time is cut kind of short for parents. Nurses working at nights are also missing that part of it because they don't see many parents and they are missing out on this educational piece in the evening time. I think even more so because we have basically limited time for parents in the NICU and special care nursery. So the teaching has to happen during those daytime hours. We probably utilize it even more. And then the parents, again, at home can use the app when they cannot be in the hospital. So I think it's utilized even more so that the teaching and education has to happen during those daytime hours.
Yeah, that makes absolute sense. Dr. Kubicka, as you think about, we're always trying to evolve our ecosystem, our mobile app ecosystem to provide continually enhanced services, continually enhanced features. As you look at the FICare app now, where do you envision it, let's say 2 years from now? What would you like the app to be able to do and look like as you move forward with it?
Yeah, so definitely we already started kind of sharing our achievements with other NICUs, and I was asked to talk about it at statewide forums. And there is a family engagement statewide project which I am co-leading right now. And obviously we advertise the app as a tool we use and it works very well. So, but I regret right now that the app is only in English. I really think that, we should have some translation available, and that could be another goal. We definitely are going to do some updates. As I told you, I always reach out to parents and ask them for feedback, and some of the features we added initially were some tools for parents. The example was I was envisioning that parents will be presenting babies at rounds, having a script and kind of presentation at rounds. And it seems like it was some few dads enjoyed it a lot, but most of the parents felt it was very stressful. They felt like they're on the stage presenting the baby. So we are going to take out some of the underutilized parts, but I think maybe enhance and add some videos to it. So there will be definitely some updates. And then finally, I'm really thinking that I was initially really hoping that we are going to add some wellness feature to the whole program for the parents. Reiki, yoga, very short kind of wellness sessions, and the COVID kind of put stop to all of it. But the app could also have some of those wellness parts kind of added or updated for parents.
Well, thank you for that. Often a lot of hospital teams come to us and departments come to us with an app idea that could do very well in our ecosystem, but you can tell they haven't put in the work beforehand. So if you don't put in that I don't know if it's always going to be a year, but if you don't put in that work beforehand, it's very difficult to get a product, a mobile device product out that's going to really meet your needs. And I think it's a credit to the work that you and your team put into this thing to be able to have an app that is, I think, so well adopted and so well utilized. You clearly identified your needs internally and challenges internally, and then clearly listened to your parents as well. And that is the perfect storm to create an amazing patient-facing mobile application. So I congratulate you and your team for doing such great work on this.
Thank you so much. And I think you are absolutely right. I wanted this product to be our NICU specific, done by our parents, with our parents, for our parents. And whoever is going to do it in the future, they definitely need to make it very specific to their own needs and environment, because otherwise it's just not going to work.
It sounds like you put together a successful model or plan to get this done. And hopefully we'll see it published or shared at some point in the future.
Yes, that's exactly what we are hoping for. So I am about to start a small kind of a study project related to family integrated care. But I have to say that I am extremely lucky to be working with the team of people I am working. So this is really not my app, not my project, but it's our team project. And that team of providers in our NICU is extremely specific, and it's just amazing. Amazing environment, very cohesive, and people are open to change. They are actually embracing the change. I want us to be the best out of the best. So.
Well, alignment can bring about wonderful things when you get everybody aligned in the same direction. Great work, Doctor. Awesome work here.
Thank you so much.
Well, before we close out today's show, I actually want to tell our listeners that they can get more information about the FICare app in action and the great work that the doctor and her team are doing over in the NICU unit over at South Shore Hospital. And they can find a story on the South Shore Health blog. It's a great heartwarming story about one family and their journey through the NICU and how the FICare app really helped them be part of the team and really ties it all in, everything we've been talking about today. So you can check that out on the South Shore Health blog at southshorehealth.org.
So that's a wrap for this month's episode of Healthcare Aptitude. Be sure to join us next month as we investigate more about the use of mobile apps in healthcare. Remember to catch the show on Healthcare Now Radio every weekday at 7 a.m., 3 p.m., and 11 p.m. Eastern Time. For more information, visit www.mobilesmith.com. Send your questions to sales@mobilesmith.com. Thank you for listening and be well.
Thank you for listening to another episode of Healthcare Aptitude, sponsored by Mobile Smith Health. Be sure to tune in weekdays at 7 a.m., 3 p.m., and 11 p.m. Eastern Time on Healthcare Now Radio.